Hi everyone, I'm Jeff Young. I am a 1996 graduate, Penn State kinesiology. So therefore I've been a professional for 21, 22 years. My expertise is in medical fitness. So during the course of my career, I have been very fortunate to have been a fitness professional at Duke University Medical Center, UCLA Medical Center's Ghana Diabetes Institute, Beth Israel Medical Center's Friedman Diabetes Institute. But my big claim to fame is for 10 years I was the fitness coordinator at Mount Sinai Beth Israel medical fitness facility in New York City called the Center for Health and Healing. During my 10 years there, we evolved into the most comprehensive medical fitness facility in the United States. And so I've just been really fortunate to have designed programs or have oversee the design of programs for nearly every type of chronic disease and orthopedic issue you can think of. And lastly, because of those types of experiences, I am also very fortunate to lecture on the topics of medical fitness, not only here at Penn State and other colleges and universities, but for organizations such as the American College of Lifestyle Medicine, the American College of Preventive Medicine, and the Medical Fitness Association. Medical fitness is the proper assessment, program design, and progression, or in some cases regression, for individuals who have chronic disease and or orthopedic issues. So what this means is that there's two categories. There's the chronic disease side and there's the orthopedic or musculoskeletal side. But one part that's missing when people talk about medical fitness in a lot of cases is that medical fitness also includes the effective collaboration with healthcare providers, and that's where my passion is, because unless someone is working in a clinical setting, most fitness professionals do not have relationships and do not collaborate with healthcare providers. And when I say healthcare providers, I'm talking about cardiologists, family medicine, internal medicine, physical therapists, chiropractors, et cetera, across the board. And this really, in my opinion, we need to truly bridge that gap. But in any case, so medical fitness also includes the effective collaboration with healthcare providers so we can connect their patients with fitness professionals. How a student pursues a career in medical fitness gets a little complex, but to try to make this as short as I can, the number one thing you're going to think about is clinical settings. So that's going to be like hospitals. So for instance, you're a student or a recent graduate who's interested in a career in medical fitness. The most obvious and probably the first place you should look is hospital systems, in your local area or an area you want to live in, wellness centers. But things that people that I've learned tend not to realize or think about is that physical therapy facilities, and especially independent physical therapy facilities, are literally their medical fitness facilities, because obviously patients are going there for their orthopedic issues. But since disease is so prevalent here in the United States, so many of the patients who go there also suffer from chronic disease. So from a fitness professional standpoint, it's a perfect opportunity for a job or a career. You can go and collaborate, network, and hopefully set up shop in the sense of a post-rehab component. And it's a win-win situation for everybody. The facility wins because they now have additional revenue. The patient wins because they're moving from rehab to post-rehab. You win because you now have a job for yourself in a clinical setting, and even the referral source who referred the patients to physical therapy, they win because their patient is now being continued to see in a nice, safe clinical setting. And then lastly, it doesn't have to be a clinical setting. So as long as you establish relationships with healthcare providers, and this can mean at your local area, just get to know through reaching out to like registered dietitians and have them refer patients to you, or family medicine, internal medicine, cardiology, physical therapy, et cetera, and establish relationships with healthcare providers. They will refer their patients to you, and even if you're working at an independent gym or something like that, technically it's still medical fitness because you are still prescribing exercise for individuals with chronic disease or orthopedic issues. Designing exercise programs for special populations, I could sit here or stand here and speak for a couple hours on, but to try to give the nutshell version, the main things that you want to be cognizant of in exercise program design is, number one, finding out whenever possible from the referral source what the person's issue is, and also find out from the referral source what should I emphasize in that person's or patient's program design, what should I avoid in their program design, any restrictions versus no restrictions. So the point being that you want to start off, whenever possible, with getting feedback from the referral source. Number two is you got to get feedback from the patient themselves. They're the ones living with the chronic disease and or orthopedic issues. So you got to ask them, how do your issues affect your activities of daily living? How do they affect you when you're exercising? And they're going to have plenty to tell you, and then you can incorporate their feedback into your program design. More specifically, you can also ask them, what would you like me to emphasize in your program design? What would you like me to avoid? Is there anything you're apprehensive about, any movements or exercises you don't want to perform, etc., etc.? So a lot of it has to do with the initial feedback. Then we get into proper assessments, which don't have time to do that in this short outline of the idea of program design. But the main things to know are that you want to start that person off very safely, obviously, and the way you do that is you back off on frequency, volume, and intensity. So in other words, from a strength training standpoint, you only start off by strength training twice a week, every major muscle group twice a week on non-consecutive days such as Monday and Thursday. From a volume standpoint, as an example, you would only have them perform 1 or 2 exercises for each major muscle group. Just keep the volume low. From an intensity standpoint, you would use rate of perceived exertion scales. So in other words, at the end of every set, you would ask them how hard it feels. And the goal is actually that you want their answer to be that it feels light to moderate. If it feels moderately hard or hard, you need to back off on the intensity. But the point being is that if you back off initially on frequency, volume, intensity, work as a team over the course of time, as opposed to you just telling them what to do. Get feedback from them and progress them in small tolerable increments. And then lastly, prior to or going into every session, just make sure that that person is hydrated, that they've eaten, that they've taken their medications, that they feel well from a physical and mental standpoint. And if you do those things, then you make it safe. And that's really how a nutshell version of how to design a program for someone with chronic disease or an orthopedic issue. Okay, so if you think about the 5 primary components of fitness, I'll just list them real quick. You have body composition, you have flexibility, strength, cardiovascular endurance, and local muscle endurance. And strength plays a primary role in all 5. For body composition, you need to strength train to maintain your muscle tissue, have adequate protein intake, and etc. Even from a cardiovascular standpoint, strength training has been shown that it increases mitochondrial density, capillary density, etc., etc. And the bottom line is it has a positive effect on your aerobic capacity. Strength is the first thing that goes in the aging process, which starts at the age of 30. So when you lose strength, strength is the foundation of movement. So when you lose strength, it negatively affects pretty much every part of life. It affects your balance, your neuromuscular control, your work capacity, etc., etc. So strength training really, research is showing that strength training is far and away the biggest bang for your buck mode of exercise. I'm absolutely not anti-aerobic. You really should have increase your aerobic capacity as well. But for so many reasons, strength training needs to be a part of everyone's program design.